Did you know that some common nutritional deficiencies and the right supplementation can significantly lower your risk of both diabetes and heart disease? In today's video, we'll explore 7 scientifically backed natural supplements that have shown powerful effects in reducing the risk of these chronic conditions. What's even more exciting is that these supplements are accessible and will also uncover the best natural food sources for these key nutrients. Whether you're looking to balance your blood sugar, protect your heart, or reduce inflammation, these supplements could be the game changer you're looking for. But before you start any supplementation regimen, we'll also discuss important safety considerations to ensure you're getting the best results without any potential risks. If you're ready to take control of your health, let's dive into these powerful nutrients and how they can make a real difference for your health. Now, let's get started with the first supplement on the list. 1. Magnesium, a crucial supplement for glucose control and heart health. Magnesium is one of the most essential minerals for overall health, yet many people are deficient in it without even realizing it. This mineral plays a critical role in more than 300 biochemical reactions in the body, including regulating blood sugar levels and supporting heart health. Unfortunately, about 57% of adults don't get enough magnesium, which can lead to various health problems, including insulin resistance, high blood pressure, and muscle cramps. Studies have shown that magnesium deficiency can worsen blood sugar control, particularly for individuals with pre-diabetes and diabetes. Magnesium helps regulate insulin function by improving insulin sensitivity, which means your body is better able to use insulin to manage blood sugar. By maintaining proper magnesium levels, you not only support your blood sugar regulation, but also reduce the risk of developing type 2 diabetes. In addition to supporting blood sugar control, magnesium is crucial for maintaining a healthy heart. It helps regulate your heartbeat and blood pressure by relaxing blood vessels, improving circulation, and preventing the constriction of arteries. By improving vascular function, magnesium lowers the risk of heart disease and stroke. This makes it an indispensable nutrient, especially for people dealing with diabetes or those at risk of heart problems. A 2017 study published in the Journal of Clinical Endocrinology and Metabolism found that magnesium supplementation significantly improved insulin sensitivity and lowered fasting blood glucose levels in participants with type 2 diabetes. Similarly, a meta-analysis conducted in 2019 revealed that magnesium supplementation reduced the risk of cardiovascular disease by lowering blood pressure and improving lipid profiles. When it comes to natural sources of magnesium, there are plenty of options to choose from. Leafy greens like spinach and kale are excellent sources of magnesium, as are nuts and seeds, such as almonds, pumpkin seeds, and flax seeds. Additionally, dark chocolate, particularly varieties that are 70% cocoa or higher, is a delicious way to get your magnesium intake. However, magnesium supplements are also available and can be beneficial, particularly if you have difficulty meeting your daily magnesium needs through food alone. When choosing a magnesium supplement, magnesium glycinate is often considered the best option because it is highly absorbable and less likely to cause digestive discomfort compared to other forms, such as magnesium oxide. As always, it's important to consult with a healthcare professional before starting any new supplement regimen, especially if you have kidney issues, as magnesium can accumulate to unsafe levels in individuals with impaired kidney function. Susan, a 58-year-old woman with type 2 diabetes, had been struggling with high blood sugar levels and fatigue. After consulting her doctor, she started taking a magnesium supplement in the form of magnesium glycinate, along with incorporating more magnesium-rich foods into her diet, like leafy greens and almonds. Within a few months, Susan noticed a significant improvement in her blood sugar control, and she felt more energetic throughout the day. Her doctor also observed lower blood pressure readings, further confirming the positive impact magnesium had on her overall health. Magnesium is an incredibly powerful tool for managing diabetes and protecting heart health. By ensuring you get enough of this vital mineral, whether through food or supplements, you can significantly improve your metabolic health and reduce the risk of diabetes-related complications. Number 2. Turmeric, the anti-inflammatory powerhouse for insulin sensitivity. Turmeric, a bright yellow spice often associated with Indian cuisine and traditional medicine, is much more than just a flavor enhancer. It's also one of the most potent natural anti-inflammatory agents available, and its active compound, curcumin, has garnered significant attention in the health community for its powerful benefits, especially when it comes to managing blood sugar and improving insulin sensitivity. Chronic inflammation plays a major role in the development of insulin resistance, which is a primary factor in the onset of type 2 diabetes. When your body is inflamed, your cells become less responsive to insulin, making it harder for glucose to enter your cells and be used as energy. This leads to high blood sugar levels, which over time can contribute to diabetes and cardiovascular diseases. Curcumin, the active compound in turmeric, has been shown in multiple studies to reduce inflammation at the cellular level. It helps to regulate the body's inflammatory response, lowering the levels of pro-inflammatory cytokines that contribute to insulin resistance. In addition to this, curcumin has been found to improve the function of the insulin-producing beta cells in the pancreas, thereby enhancing insulin sensitivity. A groundbreaking study published in the Journal of Clinical Endocrinology and Metabolism in 2015 demonstrated that curcumin supplementation helped significantly improve insulin sensitivity in people with prediabetes. The results were so promising that researchers concluded curcumin could be a valuable tool for preventing the progression from prediabetes to type 2 diabetes. But the benefits of turmeric don't stop at insulin sensitivity. Curcumin has also been shown to have heart protective effects, which are especially important for diabetics who are at a higher risk of developing heart disease. A study in the American Journal of Cardiology found that curcumin supplementation could reduce cholesterol levels and improve blood vessel function. Since high blood sugar is linked to inflammation in the arteries, curcumin's ability to reduce inflammation can contribute to better cardiovascular health. Incorporating turmeric into your daily routine doesn't require much effort. You can add turmeric to soups, stews, curries, and smoothies. If you want to maximize its benefits, combine turmeric with black pepper, which contains piperine. Piperine enhances the bioavailability of curcumin by up to 2,000%, making it much easier for your body to absorb. For those looking for a more concentrated dose, turmeric supplements are widely available, but it's important to consult with your doctor before starting supplementation, especially if you're already on medication for diabetes or inflammation. Ivan, a 60-year-old man with prediabetes and a family history of heart disease, decided to incorporate more turmeric into his diet after hearing about its anti-inflammatory benefits. He started adding a teaspoon of turmeric to his morning smoothies, combined with a pinch of black pepper. Within 3 months, John noticed a reduction in his fasting blood sugar levels and felt less fatigued during the day. His doctor also reported improvements in his cholesterol levels and overall heart health, confirming the positive impact of turmeric on his metabolic health. Turmeric's ability to reduce inflammation, improve insulin sensitivity, and protect the heart makes it an essential supplement for anyone looking to manage their blood sugar levels and reduce their risk of diabetes-related complications. With its versatility and powerful benefits, turmeric is a natural ally in the fight against diabetes. Number 3. Vitamin D, essential for insulin regulation and heart health. Vitamin D is often associated with bone health, but its benefits extend far beyond that. It plays a crucial role in regulating insulin production and sensitivity, making it one of the most important nutrients for managing blood sugar levels and reducing the risk of diabetes. In addition to its effects on glucose metabolism, vitamin D also supports heart health, which is particularly beneficial for individuals with diabetes or those at risk of heart disease. Research has shown that individuals with low levels of vitamin D are more likely to develop insulin resistance, a key factor in the development of type 2 diabetes. Vitamin D helps the pancreas produce insulin, the hormone that regulates blood sugar and enhances insulin sensitivity, allowing the body to use glucose more effectively. Without adequate vitamin D, the body struggles to maintain proper glucose metabolism, leading to higher blood sugar levels. A landmark study published in the American Journal of Clinical Nutrition found that vitamin D supplementation significantly improved insulin sensitivity in individuals with type 2 diabetes. The study concluded that vitamin D could be an effective tool in preventing and managing diabetes, especially in those who are vitamin D deficient. Furthermore, vitamin D helps regulate the body's inflammatory response, and since chronic inflammation contributes to insulin resistance, having sufficient vitamin D levels may help reduce this inflammation. In addition to improving insulin sensitivity, vitamin D plays a vital role in heart health. Diabetics are at an increased risk of heart disease, and vitamin D has been shown to support healthy blood pressure, reduce inflammation in the arteries, and improve endothelial function, the health of the blood vessel lining. A study published in the Journal of Clinical Endocrinology and Metabolism found that individuals with higher levels of vitamin D had a lower risk of developing cardiovascular disease, making it an essential nutrient for those with diabetes or at risk of heart disease. The best source of vitamin D is sunlight. Just 10 to 30 minutes of midday sunlight exposure several times a week can provide your body with the necessary amounts of vitamin D. However, for individuals who live in regions with limited sunlight or have darker skin tones, vitamin D supplements can help maintain adequate levels. Fatty fish, like salmon and mackerel, fortified foods, and egg yolks are also good dietary sources of vitamin D. Sarah, a 58-year-old woman diagnosed with prediabetes, noticed that her energy levels were low, and she was struggling to manage her blood sugar. After consulting with her doctor, she learned that her vitamin D levels were low. Sarah began taking a daily vitamin D supplement and spent more time outdoors in the sun. Within a few months, she noticed an improvement in her blood sugar levels, and her doctor reported better insulin sensitivity during her checkups. Sarah also felt more energized and noticed her overall health had improved, making vitamin D an integral part of her daily routine. Vitamin D is a simple yet powerful supplement that can help regulate insulin, improve blood sugar control, and support heart health. With its numerous benefits, it's a key nutrient in the fight against diabetes and heart disease, and ensuring you get enough vitamin D can make a significant difference in your overall well-being. If you found this information helpful, don't forget to hit that like button, subscribe to our channel, and turn on notifications so you can stay updated with more health tips and insights. Your journey to better health starts with small changes, and we're here to guide you every step of the way. Share this video with friends or family who could benefit, and leave us a comment if you have any questions or personal experiences to share. 4. Vitamin K2. Protecting your arteries and preventing calcification. Vitamin K2 is an often overlooked but incredibly important nutrient for both cardiovascular and bone health. Unlike its more famous relative, vitamin K1, which is primarily involved in blood clotting, vitamin K2 plays a critical role in regulating calcium metabolism in the body. One of its most important functions is directing calcium away from the arteries and into the bones, where it belongs, preventing the dangerous calcification of arteries. Calcification in the arteries occurs when calcium accumulates in the walls of blood vessels, leading to hardened arteries. This process is a significant risk factor for heart disease and stroke. In fact, arterial calcification is one of the key contributors to the development of atherosclerosis, the hardening and narrowing of the arteries that can lead to heart attacks. Vitamin K2 helps activate proteins like matrix glycoprotein, MGP, that inhibit the calcification process, ensuring calcium is deposited in bones and teeth instead of your blood vessels. Research has shown that adequate vitamin K2 intake is associated with a lower risk of arterial calcification and improved heart health. A study published in the Journal of Clinical Nutrition found that individuals with higher levels of vitamin K2 had a significantly lower risk of coronary artery disease. Furthermore, vitamin K2 was linked to better bone density and a reduced risk of fractures, particularly in postmenopausal women who are more prone to bone loss due to hormonal changes. For those with diabetes, the benefits of vitamin K2 extend beyond heart health. Diabetes exacerbates the risk of arterial calcification due to high blood sugar levels, which can damage blood vessels over time. Vitamin K2 helps counteract this by ensuring calcium is properly utilized in the body, promoting both heart and bone health. The richest food sources of vitamin K2 are organ meats, such as liver and dairy products from grass-fed animals. Other sources include aged cheeses, egg yolks, and natto, a fermented soy product popular in Japan. However, for many people, dietary sources may not provide enough vitamin K2, which is where supplements can play a role. Mark, a 55-year-old man with a family history of heart disease and diabetes, was advised by his doctor to improve his diet and manage his blood sugar levels more effectively. After learning about the benefits of vitamin K2, he decided to incorporate more K2-rich foods into his meals, such as natto and aged cheese. Within a few months, Mark had a follow-up appointment where his doctor was pleased to report that his blood pressure had improved, and his cholesterol levels were more balanced. Mark's doctor also noted a decrease in the calcification of his arteries, likely due to the added vitamin K2 in his diet. Mark continues to include vitamin K2-rich foods in his diet and feels better equipped to prevent further cardiovascular issues. Vitamin K2 is a powerful nutrient that not only protects your arteries from calcification, but also supports bone health. Ensuring adequate vitamin K2 intake is a simple yet effective way to maintain a healthy heart and strong bones, reducing the risk of heart disease, strokes, and osteoporosis. 5. Berberine, a plant compound that regulates blood sugar and supports heart health. Berberine, a bioactive plant compound derived from various herbs such as berberis, golden seal, Oregon grape, has gained significant attention in the health and wellness community, especially for its ability to regulate blood sugar levels and support heart health. It is one of the most researched and potent natural compounds known for its remarkable impact on metabolic health. One of the most notable benefits of berberine is its ability to help manage blood sugar levels, making it a popular choice for people with diabetes or prediabetes. Research shows that berberine can lower blood glucose levels by improving insulin sensitivity. It activates an enzyme called AMP-activated protein kinase, AMPK, also known as the metabolic master switch. AMPK plays a crucial role in regulating metabolism, increasing glucose uptake by cells, and enhancing energy production. This activation helps the body use glucose more efficiently and reduces insulin resistance, which is a key factor in the development of type 2 diabetes. A 2012 study published in Metabolism demonstrated that taking 500 milligrams of berberine 3 times a day significantly reduced fasting blood glucose levels and HbA1c, a marker of long-term blood sugar control in people with type 2 diabetes. This is comparable to the effects of some prescription medications, making berberine a promising natural alternative or adjunct treatment for managing blood sugar levels. But the benefits of berberine go beyond just blood sugar regulation. Berberine has also shown great promise in supporting heart health. It helps lower total cholesterol, LDL, cholesterol, and triglycerides while raising HDL good cholesterol levels. Studies have found that berberine can improve lipid profiles, making it a powerful tool in managing cardiovascular risk factors. One study published in the Journal of Clinical Endocrinology and Metabolism showed that berberine supplementation reduced cholesterol levels by 20% to 30%, helping to protect against the development of atherosclerosis, plaque buildup in the arteries, which can lead to heart disease and strokes. Berberine also has anti-inflammatory effects, which is crucial for cardiovascular health. Chronic inflammation is a significant contributor to heart disease, and berberine's ability to reduce inflammation in the body can have a profound impact on reducing the risk of heart attacks and strokes. For those looking to add berberine to their daily routine, it is commonly available in supplement form, often as a capsule or tablet. The typical dosage ranges from 500 milligrams to 1,500 milligrams per day, usually divided into 2 to 3 doses. Berberine is well tolerated by most individuals, but as with any supplement, it's important to consult with a healthcare professional, particularly if you are taking other medications, as berberine can interact with certain drugs, including those used for diabetes and blood pressure. Sarah, a 47-year-old woman diagnosed with prediabetes, struggled to manage her blood sugar levels despite following a healthy diet and exercising regularly. After consulting with her healthcare provider, she decided to try berberine supplementation. Within a few months, Sarah noticed a significant improvement in her blood sugar control. Her fasting blood glucose levels dropped by 15%, and her HbA1c levels improved. Sarah's doctor was impressed with the results and encouraged her to continue taking berberine while maintaining her lifestyle changes. Not only did berberine help Sarah control her blood sugar, but it also supported her heart health by reducing her cholesterol levels, giving her peace of mind knowing she was taking steps to protect both her blood sugar and her cardiovascular health. Berberine is a powerful plant compound that not only helps regulate blood sugar, but also supports overall heart health. If you're managing diabetes or want to protect your heart, adding berberine to your routine could be a game changer. Just remember to speak with your doctor before starting any new supplement to ensure it's safe and effective for your specific needs. Number 6. Coenzyme Q10, CoQ10. The antioxidant for heart and metabolic function. Coenzyme Q10, commonly referred to as CoQ10, is a powerful antioxidant that plays a critical role in energy production and cellular health. Naturally produced by the body, CoQ10 is found in every cell, with the highest concentrations in the heart, liver, kidneys, and pancreas. This antioxidant is essential for the proper functioning of mitochondria, the powerhouses of our cells, which generate the energy needed for every bodily process. CoQ10 is particularly beneficial for heart health. The heart is one of the most energy-demanding organs in the body, and CoQ10 supports its function by providing energy to heart cells. Research shows that CoQ10 helps improve heart health by increasing energy production, reducing oxidative stress, and improving the efficiency of the cardiovascular system. Studies have shown that CoQ10 supplementation can help lower blood pressure, improve endothelial function, the lining of blood vessels, and reduce the risk of heart disease. For people with diabetes, CoQ10 has even more significant benefits. It helps improve insulin sensitivity, which is crucial for controlling blood sugar levels. CoQ10 also protects against oxidative stress, which can damage blood vessels and lead to complications in diabetes, including cardiovascular disease. One study found that CoQ10 supplementation resulted in improved insulin sensitivity and better blood sugar control in people with type 2 diabetes. A particularly important consideration for people taking statin medications, cholesterol-lowering drugs, is that statins can deplete the body's natural CoQ10 levels. Statin use is associated with reduced CoQ10 levels, which may contribute to muscle pain and fatigue, common side effects of statins. Supplementing with CoQ10 while taking statins can help counteract these side effects and support both heart health and energy levels. CoQ10 is available in supplement form, either as ubiquinone, the oxidized form, or ubiquinol, the reduced active form. Ubiquinol is more easily absorbed by the body, making it a better option for individuals over 40 or those with specific health concerns. The recommended dosage typically ranges from 100 to 200 milligrams per day, although higher doses may be necessary depending on individual needs. John, a 58-year-old man, was recently diagnosed with high cholesterol and prescribed statins. He noticed he was feeling increasingly fatigued and experiencing muscle pain, common side effects of statin use. His doctor recommended that he take a CoQ10 supplement to help replenish the levels of this crucial antioxidant. After a few weeks of supplementing with CoQ10, John felt a noticeable improvement in his energy levels and muscle function. His cholesterol levels also improved, and he felt confident knowing he was supporting both his cardiovascular health and his metabolism. John's experience highlights the importance of CoQ10 in managing heart health, especially for those taking medications like statins. CoQ10 is a vital supplement for maintaining heart health and metabolic function. If you are looking to support your heart and improve blood sugar control, CoQ10 can be a powerful addition to your daily regimen. Always consult with a healthcare professional to determine the right dosage and ensure it complements your specific health needs. Number 7. Omega-3 fatty acids. The heart and brain support supplement. Omega-3 fatty acids are an essential supplement that plays a pivotal role in supporting both heart and brain health. These healthy fats are crucial for maintaining normal cellular function and have a wide range of benefits for those with diabetes or at risk of heart disease. Omega-3s, primarily found in fatty fish like salmon, mackerel, and sardines, as well as in plant-based sources such as flax seeds, chia seeds, and walnuts, help to reduce inflammation, improve blood vessel function, and lower triglyceride levels. One of the most significant benefits of omega-3 fatty acids is their ability to improve insulin sensitivity. A study published in the journal Nature found that higher levels of omega-3s were associated with significantly improved insulin sensitivity. This is particularly beneficial for individuals with type 2 diabetes or prediabetes, as it helps regulate blood sugar more effectively. In addition to their effects on blood sugar, omega-3 fatty acids are essential for cardiovascular health. They help lower blood pressure, reduce cholesterol levels, and decrease the risk of heart attacks and strokes. In fact, research has shown that omega-3 supplementation can reduce heart attack risk by 15%, making it an important supplement for heart disease prevention. For brain health, omega-3s are vital as they contribute to the formation of healthy brain cells and are a key source material for the retina in your eyes. By promoting better cognitive function, omega-3s may also help reduce the risk of cognitive decline and conditions such as Alzheimer's disease, which are closely tied to elevated blood sugar levels. However, not all omega-3 supplements are created equal. Fish oil capsules are a popular choice, but they can be oxidized when exposed to air and light, which diminishes their effectiveness. A safer option may be krill oil or algae oil, both of which are stable and offer additional health benefits. Incorporating omega-3 rich foods or supplements into your daily routine is a simple yet effective way to support your heart, brain, and metabolic function. As always, it's a good idea to consult with your healthcare provider before starting any new supplement, especially if you're taking medication or managing a specific health condition. For those looking to improve their heart and brain health naturally, omega-3 fatty acids are an essential addition to your diet and supplement regimen. David, a 58-year-old man diagnosed with type 2 diabetes, had been struggling with maintaining healthy blood sugar levels and managing his heart health. Despite following a prescribed medication regimen, he felt sluggish, and his doctor warned him about his rising triglyceride levels. David's family history included heart disease, and he was determined to take proactive steps to prevent further complications. After consulting his nutritionist, David decided to add omega-3 supplements to his daily routine. His nutritionist recommended starting with a high-quality fish oil supplement as well as incorporating more omega-3 rich foods like salmon, chia seeds, and walnuts into his diet. 3 months into his new routine, David noticed remarkable changes. His blood sugar levels began stabilizing, and his doctor observed a significant improvement in his triglyceride levels during his checkup. The best part? David no longer felt the brain fog he had previously struggled with. His energy levels increased, and he was able to focus better at work and in his daily activities. David's decision to incorporate omega-3 fatty acids into his lifestyle paid off in more ways than one. Not only did he experience better control over his diabetes, but he also noticed that his heart health improved. His cholesterol levels dropped, and his overall sense of well-being was much better than before. Today, David continues to include omega-3 rich foods in his meals and takes his supplements daily. He's made it a habit to enjoy salmon a couple of times a week, and he starts each day with chia seeds in his breakfast smoothie. David's journey is a testament to how a simple change in diet and supplementation can lead to meaningful improvements in both heart and metabolic health. In conclusion, these 7 natural supplements can play a significant role in improving your blood sugar regulation and supporting heart health. Whether you're managing diabetes or simply looking to enhance your overall well-being, incorporating magnesium, turmeric, vitamin D, vitamin K2, berberine, CoQ10, and omega-3s into your routine can provide numerous benefits. However, always remember that supplementation should complement a healthy lifestyle, including a balanced diet and regular exercise. Consult with your healthcare provider before starting any new supplement, especially if you're on medication or dealing with a pre-existing condition. By taking these proactive steps, you're not only helping to manage blood sugar and heart health, but also investing in your long-term health and vitality. Thank you for watching, and if you found this video helpful, be sure to like, subscribe Senior Health Wisdom, and share it with others who might benefit from this information. Stay healthy, stay strong, and we'll see you in the next video.